You ever stop to think about those moments when your pet gets hit with a health issue that seems to come out of absolutely nowhere?
Uh-huh.
Like they were totally fine and then suddenly, bam, something invisible, has taken hold.
Yeah, it can be really worrying.
Well, today we're going to unpack one of those sort of stealthy health
All
challenges.
right.
We're doing a deep dive into Coccidioidomycosis, or as it's, well, more commonly known, valley fever. We're using the detailed info you shared.
Exactly. And this isn't going to be like reading a dry medical text, right?
Oh, definitely not.
Our goal here is really to pull out the key stuff, clarify the tricky bits, and highlight what's genuinely surprising about this condition, especially if you and your pets live in or maybe travel through certain areas.
Right, because the sources you provided give a great overview from where it comes from to how it actually affects animals.
hmm And what we can do about it. So our mission today is basically get the essential facts, untangle the complexities, and point out the surprising things about this soil fungus.
Okay, perfect. Let's jump right in then. The culprit, the actual cause.
Yeah.
We're talking about fungus Coccidioidomycosis.
Precisely.
Yeah.
Coccidioidomycosis, it's this fungus that lives down in the soil.
Okay.
And its life cycle is, well, pretty fascinating. It grows as these thread-like structures, mycelia, in the soil.
Right.
And then it produces these tiny infectious bits called arthroconidia. Those are the real troublemakers.
And how do pets get exposed? Is it just breathing them in?
That's the main way, yes. Inhalation of these arthroconidia. That's how animals, and people too, usually get infected.
And I found this part just incredible, the number of spores it takes. The material mentioned, fewer than 10 can actually cause infection in some animals.
It's kind of mind-blowing, isn't it? Fewer than 10 spores.
Wow.
And here's where it gets really intricate. Once those spores are inhaled, they get into the warm body environment, and they change. They transform pretty quickly, like within a couple of days, into what's called an immature spherule.
Spherule, okay.
Yeah. This spherule then matures, grows, and eventually it bursts open.
Oh, wow.
And it releases hundreds, like 200 to 300 of even smaller things called endospores.
Good grief.
And each one of those endospores can then become a new spherule. It's like this multiplying cycle inside the body.
So it's like setting off these tiny fungal explosions internally? What about the body's immune system, the first responders, neutrophils?
Yeah.
How do they handle that?
Ah, that's a really key point. Neutrophils are usually quick on the scene, right?
Right.
But they have a tough time with coccidioids. They actually can't get through the thick wall of that mature spherule.
Really?
Yeah, but they can attack the endospores after the spherule ruptures.
I see. So it's a two-stage problem for the immune system.
Exactly. It makes it quite difficult to clear the infection completely.
Okay, so we've got this microscopic fungus with a surprisingly complex battle plan. Now, where does this actually happen? Geographically speaking, it's not everywhere, is it?
No, not at all. It's quite specific. It's mainly found in what's called the Lower Sonoran Life Zone. Think southwestern U.S.
Okay, like Arizona, California.
Exactly. Your sources highlighted Southern California, Arizona, Southwest Texas as the main spots. It's around in New Mexico, Nevada, Utah too, just less common.
So if you live there or travel there with pets, this needs to be on your radar.
Definitely. Absolutely.
What about different animals? Are some more likely to get seriously ill than others? Dogs versus cats, for example.
Good question. Yes, there's a difference. Dogs seem more prone to getting the disseminated form.
Disseminated meaning it spreads.
Right. Spreads beyond just the lungs to other parts of the body. That seems to happen less often in cats.
Interesting. And age. Does that matter?
Well, we see it in animals of all ages, but it does seem to be diagnosed most often in younger ones, like under 4 years old, typically.
Maybe just because they're more curious, sniffing around more?
That's likely part of it, yeah. More exploring, more digging, more chances to inhale those spores.
Which brings us to risk factors. The sources mention things like dust storms after rain and even earthquakes or construction.
Yes, exactly. Coccidioids lives a bit below the surface, loves it hot and dry. After it rains, the fungus can kind of move up towards the surface and release spores.
Wow, okay.
Then a dust storm comes along. Perfect way to spread those spores through the air. Big time.
Right.
And anything that disturbs that soil, earthquakes, digging for construction, land development that kicks the spores up into the air too.
Makes sense.
And yeah, like you said, pets that are really active sniffers, digging in the dirt, rooting around in bushes, they're just naturally at higher risk of breathing in more spores.
Okay, so we know who's most at risk and where. What about recognizing it? What are the first signs we should look out for in our pets?
The initial signs often involve the respiratory system. They can show up, pretty quickly after exposure, usually within about 1 to 3 weeks.
Okay, that's fairly fast.
And this is important. If the infection spreads, the signs of that dissemination might not appear for months.
Months. Wow. Okay, so what are the common things we might see, say, in dogs first?
In dogs, typical signs include things like a fever that just won't quit, even with antibiotics.
Stubborn fever, got it.
Yeah. Lethargy, just seeming really tired, not much energy, not wanting to eat. And coughing is a big one.
What kind of cough?
It can vary. Sometimes it's a dry, hacking cough. Other times it might sound more moist, like they're bringing stuff up. Joint pain or stiffness is also really common, almost like sudden arthritis.
Okay, and if it does spread, if it disseminates in dogs, what does that look like?
That's when things get more serious. You might see actual swelling in their bones or enlarged joints. Lameness, obviously, if their bones or joints hurt.
Right.
Swollen lymph nodes are common too. Skin lesions can pop up. Sometimes they ooze fluid.
Skin lesions, too.
Yeah. And then there are the more alarming signs if it gets into the nervous system. Things like seizures, wobbliness, or lack of coordination, that's ataxia, or even just changes in their personality or behavior.
Neurological signs, wow.
Mm-hmm. Eye problems can happen too, inflammation inside the eye, like uveitis, or on the cornea, keratitis. And the source mentioned a weird, less common thing, skin lesions developing around penetrating wounds sometimes.
That's a huge range of possible symptoms. Makes me think diagnosing this must be really tough. What about cats? Similar signs.
There's definitely overlap, but the sources emphasize that in cats, skin lesions are often the most common sign you see.
Ah, okay. Skin first in cats, often.
Yeah, but they can also get difficulty breathing, lameness if bones are involved, and eye inflammation, that uveitis, just like dogs.
Okay. So given all these symptoms can point to lots of different things, how do vets actually figure out if it is valley fever? It sounds like a puzzle.
It really can be. You're right. The symptoms mimic so many other conditions, other fungal infections, lymphoma, bone tumors, even straightforward bacterial infections.
So lots to rule out.
Exactly. And if there are neurological signs, you also have to think about things like inflammatory brain disease or, again, cancer. So it usually takes a combination of tests.
Okay, let's start with the basics. Routine blood work. What clues might that give?
Standard blood tests can sometimes show, well, hints. Maybe a mild anemia, not enough red blood cells being made. Often see high white blood cell counts, specifically neutrophils and monocytes.
Okay.
On the chemistry side, high globulin protein levels and low albumin levels are pretty common findings.
Huh.
And depending on which organs are affected, you might see other changes too. A urine test might show proteinuria, suggesting kidney inflammation perhaps.
So those are like general indicators that something's wrong.
Yeah.
What about tests specifically for valley fever? I saw serologic tests mentioned. Antibodies.
Yes, serology is really useful. Tests like AGID or ELISA look for antibodies the body makes against the coccidioids fungus.
Okay.
It gives a strong presumptive diagnosis. And it's also good for tracking how well the treatment is working over time by watching those antibody levels, the titers.
Titers, right.
One important thing, though, if the first test shows low titers, but the pet clearly has symptoms, it's often worth repeating the test in maybe 3 or 4 weeks. It can take time for those antibody levels to rise enough to be detected easily.
Good tip. Okay, what about imaging? X-rays, MRI.
Imaging is key, too. Chest x-rays might show patterns in the lungs, like inflammation, these sort of hazy areas called infiltrates.
Mm-hmm.
If bones are involved, x-rays can show damage, these willitic lesions. And MRI is particularly good for spotting inflammation or granulomas in the brain or spinal cord if there are neurological signs.
But the absolute proof, the gold standard, is actually seeing the fungus itself, right, under a microscope?
Exactly. The definitive diagnosis comes from finding that distinctive spheral form of coccidioids in a sample.
The sphere we talked about earlier.
Right. They're relatively big, 10 to 80 microns across, round, thick, double wall, packed with those endospores inside. Very unique looking. If you see that, you know what you're dealing with.
So how do vets get that sample? Is it difficult?
Sometimes it's straightforward. You might get it from aspirating a swollen lymph node with a needle, or scraping a skin lesion, or dabbing a draining tract. Culturing the fungus is possible, but that has risks. It has to be done in a special lab with safety hoods because the mold form that grows in culture is infectious through inhalation.
Ah, okay. Safety first.
Definitely. So often, if possible, a biopsy of an affected tissue like lung, bone, skin is preferred. It gives the best chance of finding the spherules.
But Getting a biopsy might not always be easy, depending on where the infection is.
Precisely. Sometimes getting to the affected tissue is invasive or risky. And that's why serology, the antibody testing, is often such a practical and crucial first step in diagnosis.
Okay, so we've tracked down the enemy, figured out how to spot it. Let's move on to fighting back.
Yeah.
Treatment. Is this something we can manage effectively?
Well, it's important for everyone to understand this is a serious fungal infection. Treatment is often a long haul,
How long are we talking?
often more than 6 months. And if it's disseminated, spread through the body, you're frequently looking at least a year of pretty aggressive antifungal medicine.
A year. Wow.
Yeah. And that, also means it can be quite expensive for pet owners. It's a big commitment.
Okay. The source material broke down some specific antifungal drugs for dogs. Let's go through those. Ketoconazole was mentioned first.
Yes. Ketoconazole is one option. It's an oral medication, usually given twice a day. Best given with food to help absorption.
Okay.
Treatment typically needs to go for at least 6 months to a year, minimum, and you have to monitor. If the antibody titers go up or symptoms get worse early on, you might need to switch to something else.
Okay. Next up was fluconazole. That one sounded maybe a bit more promising.
Fluconazole often does have higher success rates reported. A key reason is it gets into the central nervous system better than some others.
Ah, important for those neurological cases.
Exactly. Neurologists sometimes even use higher doses for brain or spinal cord infections. And thankfully, the cost has come down a lot with good generic versions available now.
That's good news.
But the source did warn against using compounded chemical-grade versions. There have been treatment failures linked to those, so sticking to the medical-grade stuff is important.
Got it. What about itraconazole? How does that compare?
Itraconazole is another oral azole, like ketoconazole. It's thought to get into body tissues maybe even better than ketoconazole.
Okay.
And some studies suggest it might even be more effective than fluconazole in some situations, so another good option.
And then there was amphotericin B. Sounded like a heavy hitter, but with significant risks. Kidney issues.
That's right. Amphotericin B is very potent, but it can be tough on the kidneys. That really limits its use, especially now that we have these effective oral drugs.
So it's not a first choice usually.
Rarely. If it is used, it's given intravenously, maybe a slow drip over hours for really sick animals or a faster push for more stable ones. The source gave specifics on dosing and stressed giving IV fluids at the same time to try and protect the kidneys.
Right. Minimize the kidney risk. Okay. What about treating cats? Is it the same drugs?
Pretty much. The good news for cats is that any of those azole drugs we talked about, ketoconazole, fluconazole, or butraconazole, can be used. The source gave specific dose ranges for cats for each one.
Okay. Now, besides the antifungals themselves, what else is important? Supportive care.
Absolutely crucial. You need to manage any other symptoms the pet has, like pain, seizures, that cough we mentioned.
Right.
Activity restriction is also important. Let their body focus on healing and making sure they eat well, a high-quality, tasty diet to keep their strength up.
Makes sense. And what should owners expect? What do they need to know for the long term?
Education is key. Owners need to understand it's often a long treatment, potentially a year or more, with significant cost.
And relapses can happen.
Unfortunately, yes. Especially with disseminated disease, relapses aren't uncommon even after successful treatment. It's something to watch for.
But it's not contagious, right? To people or other pets.
Correct. That's important reassurance. You can't catch it directly from your sick pet.
Okay. And sometimes surgery is an option.
In specific cases, yes. If the infection is walled off in one spot, like a single granuloma, sometimes surgically removing it can be part of the plan.
What about medication side effects or precautions? Liver, kidneys.
Good point. The azole drugs, keto, fluco, itra, are mainly processed by the liver. So you need caution if the pet has liver issues already, or if they're on other drugs the liver handles.
Okay.
Amphotericin B, as we said, affects the kidneys. So caution with kidney disease or other kidney toxic drugs.
And potential side effects to watch for.
With the azoles, things like loss of appetite, maybe vomiting, and potentially liver toxicity. That's why monitoring liver enzymes and blood work is important. Though the newer ones, gluconazole and itraconazole, tend to cause fewer side effects than ketoconazole.
And amphotericin B.
That one can cause more severe issues, mainly kidney problems, but also fever. Requires very close monitoring.
So monitoring seems absolutely essential throughout. What does that look like typically?
Yes. Diligent monitoring is vital. Usually involves checking those antibody titers in the blood every 3 to 4 months. The goal is to treat until the titers drop way down, ideally to less than 1.4, and stay there.
And stay on treatment until then.
Generally, yes. And sometimes, if a pet on itraconazole isn't responding well, especially a generic or compounded one, checking the actual drug level in their blood might be useful to make sure they're absorbing it properly.
Ah, goes, yeah.
And with amphotericin B, it's regular blood tests for kidney function creatinine and checking the urinalysis to catch any kidney damage early.
Okay. Now, prevention. Is there anything we can actually do to stop pets getting this in the first place? A vaccine, maybe?
Unfortunately, no. There's no vaccine currently available for dogs or cats.
That's a shame.
It is. So prevention really comes down to trying to minimize exposure, avoiding digging in endemic areas, especially during those high-risk times like after rains when dust storms might kick up. Easier said than done sometimes.
Yeah, especially with an adventurous dog. Are there any complications that can pop up during treatment itself?
One thing mentioned in the source is that sometimes the cough might actually get worse for a bit right after starting the antifungal meds.
Worse. Why?
It's thought to be due to inflammation flaring up in the lungs as the fungus starts dying off.
Ah, an inflammatory reaction.
Exactly. If that happens, sometimes a short course of a low-dose steroid like prednisone, plus maybe a cough suppressant, can help manage it and keep the pet comfortable.
Okay, so looking at the big picture then, what's the overall prognosis? What can owners realistically expect if their pet gets valley fever?
It really varies. For cases that stay just in the lungs, the localized respiratory form, the prognosis is generally pretty good with treatment.
That's encouraging.
For disseminated disease, where it's spread, it's more guarded. But many dogs do show significant improvement with the oral antifungals. Maybe up to 90% see their signs resolve.
It's still quite good.
It is, but again, relapses are common, especially if treatment stops too soon. Prognosis is definitely poorer if it's gotten into the central nervous system.
And for cats.
Less data overall, but generally similar expectations. Long-term therapy is likely needed, and relapses can happen. Post-treatment monitoring with those titers is crucial for everyone.
And just hoping it goes away on its own isn't really an option?
No, spontaneous recovery from disseminated valley fever without treatment is extremely rare. Intervention is needed.
Okay, so let's try and wrap this up. This deep dive really shows that Coccidioidomycosis, valley fever, it's this fungal threat hiding in plain sight, really, in the soil of specific areas. And it gets into our pets just through breathing. Recognizing those symptoms early, getting that veterinary diagnosis, even though it can be complex,
Right.
and then committing to that potentially long treatment plan, it's all critical for a good outcome.
Absolutely. Awareness is key. Knowing the risks, especially if you're in or travel to those endemic spots in the Southwest, and knowing what signs to watch for, that can make all the difference in getting timely help.
It really makes you think, doesn't it, about how these invisible things in the environment can directly hit our pet's health. It kind of makes you wonder, what other unseen elements in our surroundings might be playing a role in their well-being in ways we haven't even considered yet?
That's a fascinating thought. Definitely food for further curiosity and maybe even research down the line.